everyone, it's Dr. Rick, and today's unboxing is on Dr. Solomon's Rescue Transdermal Lotion. This is a medical cannabis product. You can find it in a couple of different medical cannabis dispensaries in the state of Illinois. And for those of you who follow me on my YouTube channel or my Instagram, you'll know that I do unboxings, and I've dedicated some of my videos to medical cannabis products. We are growing and we're getting better with regards to the cultivators and the dispensaries as far as products available, but we have yet to catch up to Colorado's wide menu selection. And when I take people up to 14,000 feet in Colorado, I usually will suffer a little bit as far as inflammation. In fact, I'm going for an echocardiogram today, so I'll probably do a video on that. Check out my YouTube channel and you'll see the videos I do. I have to control the inflammation when I get back down from the big excursions in order to go back up again and lead another hike. I usually take younger people, but it's important to use medical cannabis in a way that will control inflammation, yet not get high. Now, there's some people who use medical cannabis for recreation, and that's fine. There's also some people who use medical cannabis to turn off anxiety, help with sleep, and that's also fine. But you have to fine-tune the products that you use to not have too many side effects, and that's what we're going to talk about. So I have people who just want pain relief, or people who are cannabis naive. My older boomers in their 60s and 70s, they just want to take care of sleep, or they want to take care of aches and pains, especially around joints. Most of my 60 and 70-year-olds are already tired, and topical would seem to be the way to go because you would figure no high and just apply it, and then you can avoid the brain problem of having it edible or inhaling. So let's talk about that right now. When you have a medical cannabis product, if you take it by inhalation, meaning you smoke or you vape, when you burn plant, it becomes activated. When you activate the ingredients in the plant, and there's about 141 different active ingredients in a plant, THC and CBD are just two, and then there's 139 others. But when you activate it and then you inhale it, it goes into your lungs, and then when it goes into your lungs, it goes into your bloodstream, and when it goes into your bloodstream, it goes to your brain, and you have the effect. And there's hardly anything that stops as a barrier. You're guaranteed you're going to have the effect that you want, but it's going to be fleeting. It'll go up to a decent level and then go back down. That's the way inhalation works or vapor works. And when you have an edible, you have the component of the plant activated, decarboxylation processed in the cultivators, and it's put into an edible form, whether it's a tincture, which is a liquid, or a gummy, which is a candy piece, a chocolate or a sugary edible, or it can sometimes be put into a baked good. But either way, when you process that, you have to activate it and you put it into the product that you're going to sell. And then when the person gets it, they eat it. If it's a tincture that you put under the tongue, which is an oil, hopefully if the mouth is good and the tongue is in good condition and the mucous membrane under the tongue is in good condition, then the flora in the mouth is decent, you will have the effect. If the oil is a good quality, it gets through the mucous membrane, gets into the bloodstream, and goes to the brain. Then you can swallow the rest and it gets into the stomach. Now the problem is, like every other edible, once the edible product gets into the stomach, you're a slave to the function of the stomach. So if your stomach is terrible with acid, or you're on an H2 blocker, if you're on omeprazole or Protonix, if you have IBS, then the absorption is going to be unpredictable. If you have leaky gut, if you have hypersensitive stomach, you're going to not be able to predict the absorption of your edible. It can kick in 2 hours, it can kick in 10 minutes. So it's very difficult to predict that. And that's why when you ask the bud tenders for which medicine should I take, I don't want to inhale, you might not get the effect you want with the edible you choose. So you have to experiment. And then once you find the effect you want with the edible you choose, the question is, can you continue buying the edible? It might not be there. And we are getting better with our menus in the state of Illinois. Now, topical, you would figure, can be more predictable because all you have to do is slap it on skin. The product, after it's activated and processed and put into cream, you put it on the skin, it gets absorbed and it goes into the bloodstream, goes to the brain or the muscle, and hopefully that's the effect. And that, in theory, should work. But everybody's quality of skin is a little bit different, so that is unpredictable too. If you have bad skin, if you have dry skin, if you have thin skin, if you have fat, so if you're super skinny, that will change the absorption rate as well. Let's unbox this thing. Let's see how it looks. This is the Ziploc, and I hate, for some reason, I knew it. just for the video, open and see how this looks. These are the other topicals. That's how the bottle looks. Oh no, it's just a it does not smell like marijuana. It comes on kind of shiny. There's no smell. Some of these other products, it really smells like marijuana. And oh, by the way, if you have topical, you have to be careful when you apply this, because if you apply it to exposed areas and then you go pick up a child or your pet might lick it. Your child might not lick your arm, but you might have the product rub off on your child or your significant other. If your significant other is a DOT driver, Department of Transportation driver, and it rubs off on their skin and then they get tested, it can turn positive. So you have to be careful with that part. So I guess you should consider rubbing it underneath your clothes so you don't rub it onto or transfer it over to somebody else. I don't really feel any menthol. And this is 100 milligrams of THC. The consistency is good. It's a little bit shiny. Doesn't really have a carrier that is offensive. I'll let you know. I'll put in the comments section if it makes me high. I doubt it. None of these topicals have really affected me. The product that I create, this is just DMSO, but if I put a ton of RSO oil in here, I can get a little bit relaxed by using this at night. If I can put it on areas that don't have much fat, like my shins, I can get it absorbed, but I have to crank up the amount of RSO oil and the type of, usually I'll choose an indica heavy RSO, and I can create something that will get through, but the majority of topicals in the state of Illinois won't do that. Hopefully this gives you a couple of ideas. So Dr. Solomon's is pretty decent. No smell if you're worried about that. As far as whether it helps get through the skin and helps a joint as far as aches and pains and joint pain, especially if you have arthritis, I'll report in about half an hour how it helps my arm, if it does anything. I'll also report in the comments section about if it causes any side effects. I doubt it. If you like this video, give it a thumbs up. If you have anybody that's using topical, if you use topical and you like a certain brand, certainly put them in the comment section down below. I've evaluated all these other topicals and they're kind of plus minus. Don't forget to subscribe if you have a liking to any of the videos I have on my YouTube channel. Otherwise, I'll see you at the next video. Thanks.